Hi everyone. Today we will discuss about the topic first aid management of foreign body obstruction. So, any external objects or any foreign body will obstruct in the children's. Usually, it is in children's ear, nose, throat, or eyes. We will call it as a foreign body obstruction that need an immediate management. Usually, the children will complain about the pain that if it is in ear or nose, eyes, the children will complain about the pain, and later it may lead to infection. That's why it is very important that the early stages itself we should find the foreign body object and should extract it out with the help of a healthcare provider. So, as a nurse, we should educate priorly to the community people that if we got a foreign body obstruction case, tell them to, if the case happens, should go to the hospital and take that foreign body out. Don't try to self management. That is also a major point. So we can go through what are the first aid management for these foreign body objects in different parts of our body. So in the first aid management of foreign body in the ear, nose and throat include may child, infants or sometimes adults also accidentally put some external objects into their ear, nose or mouth and get obstructed. That time we will call it as a foreign body obstructions. So in objects in the mouth or throat may swallowed or that may lead to aspirated into the respiratory tract and will lead to asphyxia or respiratory difficulties. Objects in the ear or nose may make it difficult to hear or breathe and may lead to infection. So first we can discuss about foreign body in the ear. Any external objects or any foreign body, if stuck in the ear canal, we will call it as a foreign body obstruction in the ear. So usual materials include food, insects, toys, buttons or pieces of crayon, small batteries, etc. So this is the picture showing the removal of foreign body. So the treatment of foreign body in the ear include first the client or the patient will admit or come to the casualty because of foreign body in the ear. That time we can use some instrument to take it out, or sometimes if it is a metal object we can use with the help of a magnet we can take it out. Sometimes ear irrigation we can go, and sometimes a machine section we can go. After removal, we should re-examine the ear to determine whether any injury happened, why we are re-examine, if any injury or any part of material is remaining there, that all purpose we should find out or re-examine the ear again. And we can administer one antibiotic drops for the ear to or prophylactically to avoid the further infection. Next, we can go through the foreign bodies in the nose. So the client or the child will have the breathing difficulty or some type of breathing problems they will show. That time we should observe the client's nose. In that picture it is showing no like that. We should examine the nostril area to find out any obstruction or foreign body in the nose. So maybe usually to tissues, clays, pieces of toys or erasers are stuck in the or as a foreign body. These are the common foreign bodies. Next is symptoms. The client may experience or sometimes they will have a nasal discharge and sometimes bad odor also they experience. So this is the picture showing the foreign body extractor will use to extract the foreign body. So the treatment includes some of the technique that may be used by healthcare providers include suction machines can use, instruments may be used, can insert to extract the foreign body. After removal of the object, the healthcare provider should administer a nasal drop or antibiotic ointments. That is common for all first aid management. Next is throat, foreign bodies in the throat. If the foreign bodies can get stuck in the many different places in the airway. So small objects like seeds, toy parts, grapes, pebbles, nuts, buttons, coins, anything can stuck on the throat and may lead to aspirate into the respiratory tract. Sometimes it may swallowed into the GH system also. So that respiratory tract will give the more complicated problems. So Symptoms include choking or gagging when the object is first inhaled, and later stages like coughing, wheezing sound we can hear, and sometimes no foreign body is still causing the airway obstruction. Then the child may have the symptom like stridor, that is a high pitch sound usually heard when the child breathes. That stridor voice we can hear, stridor sound, then cough that gets worsened, child may be unable to speak, pain in the throat or chest, hoarse voice, blueness around the lips because of cyanosis, and not patient is can't breathe properly, dyspnea features will be there, and sometimes patient may lead to unconscious stage. These are the complicated stages. So management include open the mouth, tongue and jaw lift maneuver we can use to find out or to locate the obstruction or where the material is stuck. Insert the finger or any objects we can or instrument we can apply and take the or hook the object and sweep it out and remove the object. So next is foreign body object in the eye. So here sand particles, usually traveling time the patient, or it is very common in the adults. While traveling only, it is more getting sand particles or small pieces of glasses, metals that may stuck under the eyelids or eyeball or cornea, it will stuck. So eye irrigation is a very common procedure. As a first aid management we can apply. So we can tell to the every community people that if any objects, foreign objects stuck on their eyes, we have suspected that there is something fall on our eyes. That time immediately tell them don't rub their eyes. That is the first and foremost health education point we should educate them. Next is to wash or irrigate their eyes with the help of a tap water also. So that's the 2 points we can give as a first aid manual. Still, the objects are there. Still, the patient is having the pain symptom or irritation is there. Tell them to go and consult a doctor or a healthcare provider. So first thing, wash the hands with soap and water to avoid the further problems. If our hands are again having any sand material or something, it may lead to again infection to our eyes. So try to flush the object out of your eyes with gentle stream of clean warm water. Then get into a shower and aim a gentle stream of lukewarm water on your forehead over the affected eye while holding your eyelids open. So we should use this maneuver to extract our eyelids and we can apply the water. Then if contact lenses are there, first we should remove the contact lens, then we should irrigate with the water. Sometimes the foreign objects may embedded on the contact lens. That's why we are telling to remove contact lens, then we can irrigate the eye with water, lukewarm water. So this all the management part of a foreign body in the eyes. So far we discussed about foreign body obstruction in the nose, ears, throat and eye. These all are very important. In case of children, it is very important point. Usually children will have the problems with foreign body objects, especially in the nose, ears and throat. Eye, foreign body in the eye is very common in the adult. Traveling time they will get. So tell them to wear sunglasses for adults, health education, and for children. Some parents, we should educate that if the baby have a complaint of ear pain, nose pain, breathing difficulty, any extra sound they are hearing while breathing of the child, these all things the parents should notice immediately and should take appropriate action for that. That is very important because if we are avoiding like these small symptoms, that may lead to further complication, complete damage to that particular sense organ may happen. So be safe and to avoid like this mistakes. So should as a nurse we should educate in a community level to all parents and all the adults about this foreign body obstruction and its management. I hope everyone got little idea about